The facts are devastating. More than 2,500 people in BC died from toxic drugs last year. That's an average of 7 people per day, the worst year on record. It's become the major crisis of Lisa Lapointe's time as chief coroner, a job she leaves in a few days.
Our politicians need to be courageous. They need to push back against that narrative that we are providing drugs, and I hate to use this word, to drug addicts. That's an ugly word. It's stigmatizing, it's dehumanizing.
The political courage she calls for is around the so-called safer supply approach. Access to drugs that aren't contaminated, in some cases, but not always, prescribed by doctors. Lapointe has seen the lives lost and the impact on families. We also visited families, including these mothers back in 2017. Substance abuse, and for some, the death of their sons brought them together.
22 years ago, I gave birth to Tristan. Today, I buried his ashes under this tree.
You know, every day people are dying and families are being broken.
And this is how birthdays are being celebrated, right? It's like, this is my son's birthday party. This is it.
As you watch that tape, what goes through your mind?
Well, of course, my heart goes out to the family. I'm a mother, and the thought of losing your child in that way, preventable death, it's heartbreaking. And I also hear echoes of other mothers that I've spoken to, and the heartbreak that I hear in their voices and that I see in their eyes, the frustration that we know this crisis is happening in our province. I also see there's such a misperception that this is a downtown east side problem or a Surrey, Wally Strip problem. Mm-hmm. And that mother and that situation is what we see. It is families in suburban neighborhoods, rural communities, people just like us, and not to diminish the impact mm-hmm. on the downtown east side, which is horrific. But the majority of people dying are dying in neighborhoods across the province. Families that, for one reason or another, their loved one has had some challenges with substance use.
2,511 deaths last year in British Columbia from illicit, unregulated drugs. And so I'm curious about your reaction to that staggering number. Is it sadness? Is it frustration? Is it helplessness?
All of the above. For me, it is a staggering number, but it is also the people. It is the names and the faces behind those numbers and their families. And that's what really hurts the most, that all of those families are suffering and all of those families are grieving. And, we're just seeing the trajectory continue to rise, and it's terrifying.
This is a big, complex problem. Are there things that could be done that would significantly reduce the number of these deaths, let's say, in 2024?
Yeah, so we've held 3 death review panels into this, and the common refrain through all 3 panels is evidence-based treatment, a continuum of care, recognizing that we have criminalized this problem for so long. We had a massive infrastructure built to respond on a criminal level, courts, police, institutions, but we haven't built the infrastructure to respond on a health level. So that continuum of care for treatment, prevention, all of those things. But in the immediate, right now, separating people from the toxic drug supply, because as long as people are dependent on that illicit drug supply, they will continue to die. It's so highly toxic and unpredictable.
So this is the so-called safer supply, right? This is providing drugs or making drugs available to people that has been tested so that it isn't contaminated with things that will kill them. You're about to leave your role as chief coroner. Maybe you're a little freer to speak about this. I think a year ago, I got the sense the provincial government was kind of on board getting in the direction that you're suggesting in safer supply. They seem to have backed off. Are politics at play here?
Access to safer supply has been so limited. So of 225,000 people at risk, 4,200 currently have access to prescribed safer supply, 2%. So the other 98% of people are at risk. And I think there is, I'm not a politician, and I think that's why it's so important that the coroner service be an independent, impartial, objective service. We look at the data, we provide recommendations to prevent deaths, but we're not political. And there is a lot of pushback right now from people from an ideological perspective think we should go back to the practices of the past that got us here in the first place. So it's trying to push back against that with rational argument, data, evidence from evaluation from some of the pilot studies, and saying, we understand this is novel. It's going to be a process. We continue to measure, adjust as necessary, like we did with responding to COVID, but we have to do something different.
So when I look at public reaction to drug policy in British Columbia, there's some compassion, but there's also frustration. There are a lot of people, and they'll attach their names to this public criticism, will say, we're tired of watching people use drugs in public. It makes us feel unsafe. It's unsavory. It's not the kind of, in Vancouver, city we want to have. And here's the chief coroner or people in government who want to hand drugs to people who use drugs. They want to enable this, and we're tired of it.
Yeah, and that's a really great point, Ian. And I think what I would say is we're all tired of it. Nobody wants to see that. Where we may differ at this stage is in the response to it. So nobody wants to see people who are unhoused, living precariously or living precariously housed on the streets, living on the streets, doing everything that their whole life is on the streets, including using drugs if they are drug users. That is not something any city wants to see. So how do we respond to that? Do we push them further into the shadows where they are far more at risk of dying and kind of wash our hands and say, okay, well, now I feel comfortable, I can walk down the street? Or do we respond in a more compassionate way and say, we need to solve this problem? What is a long-term solution that will reduce the vulnerability of these people, that will reduce the harms that are happening?
Your tenure as chief coroner coincided with the pandemic, a public health crisis, but definitely coincided with this illicit, unregulated drug crisis. And you leave with certainly the drug crisis unresolved. So now you have maybe your last chance to kind of get a message to the public. And what message do you want to give them about the drug crisis?
It's so important to recognize that this crisis is a result of the toxic illicit market. So first and foremost, we need to address the toxic illicit market. Unless we're okay with watching 2,500 of our community members die, people who are valuable to us, then we need to be willing to look at this rationally. I hope that people will look at this rationally, look at the evidence, and not be taken in by those who say, oh, if we go back to what we've always done, we'll fix it. We don't. It's a different time. We have to have a new lens and listen to the data and listen to the healthcare professionals.
Lisa Lapointe, a real pleasure speaking with you. Thank you very much.
Thank you, Ian. Thanks for having me. I appreciate it.